Good afternoon. I'm Dr. Bill Wyatt, and I'm a general dentist, but I've done nothing but orthodontics for the last 42 years, and I'm work with the American Orthodontic Society, and this is a group of a society here really that is dedicated to teaching orthodontics to pediatric dentists and general dentists and any other dentist that wants to learn orthodontics. We believe that everybody should know a good bit about orthodontics, and especially if you're going to try to treat or work with the children, you really need to know some interceptive and preventive orthodontic things, which this video will bring out here. What I'm going to talk about is what ectopic eruption can do when not treated early. If you go in there early and treat it, all you have to do is just hook a tube, just bond a tube on the ectopically erupting tooth, which would usually a 6-year molar. This type of ectopic eruption is a 6-year molar coming in high on a deciduous second molar, and the cells get underneath the tissue there to the deciduous tooth and just eat the root right out from under it, and the permanent 6-year molar goes forward then and takes up the space of the deciduous second molar. I'll show this in this video. Now if you'd have gotten to it early and you saw it coming in, all you have to do is just put a little tube on it and then put one of those springs for uprighting a tooth on there, and it'll kick it out to the back and let the permanent tooth come down behind the deciduous second molar, and you won't have any of this problem. And this is a pretty simple thing to do, but you've got to see it early and recognize what's happening. Otherwise, you'll end up with a case like this. And I wanted you to see the results of a untreated ectopically erupting 6-year molar, and what the problem and how much trouble it is to correct that after you let it go, and show you how it crowds out the bicuspid. This is a darn good little video and a lot to remember on here, so I hope you'll watch it, especially if you're a dentist working with children and young people. It'll be of real interest to you. So anyway, we'll get into it here. This is a cute little gal, and just as nice as she can be, and she had gone through this ectopic eruption without having anything done to it, and so she comes in later, and we've got the results of the ectopic eruption, which I'm going to show you in video, also not video, but Panorex x-rays. You'll see a lot of it, and it's primarily on I think the right side here. Now the teeth here, the center line you see is shifted off in this direction, because this moves back there. The 6-year molar comes in up high and doesn't push on these teeth, so these drift backwards, and then the other teeth come forward, and you're going to be crowded as all get out on this right side of the mouth. And the left side seems to be in pretty good shape. You see, not a big problem over here. Okay, now if you're used to looking at models, you see, the center of this model is kind of bending off to that side. You see, it's kind of tilted over there. It's not, this is not the same for sure. Now look real careful, and if you understand about 6-year molars, they spin on their lingual root, and so they rotate like this. Now this side had rotated badly. Over here there was some of this ectopic eruption or eating away of the deciduous root, but it didn't do enough, and so the tooth came up behind it, but still this tooth is rotated like that. Now we're going to have to rotate these back, and we'll show you that on the final film. As you rotate them back, a lot of times the buccal roots will just move back, and the lingual root, which is pretty big, will stay pretty close, but you have to open up the space in here now to get the second bicuspid into the mouth, and you're going to bring this back and bring the midline back over here where it originally was. There's a lot more to this than just meets the eye when you first look at it. A lot of people, unless you're used to messing with this, you won't see it. If you don't know what's going on in there and what the problem is, frequently you do not see it at all. And so a lot of these cases just go on, and the dentist doesn't understand this problem, and so he doesn't refer you to somebody who does understand it. And then a lot of the orthodontics, back in when I first started this, they didn't mess with the kids till they got 12 or 14 years old. At least they didn't want to. Now some of them I'm sure must have been. So let's see what that shows us here. But just remember this model. We're going to show you her teeth later on finishing this up. Alright, down on the bottom, no big deal. There's a lot of little flaws and things, but nothing to speak of. Now my throat is kind of irritated and sore, and I get hoarse talking this, but I would like to get through this one if I can. Okay, on the cephalometric picture here, this was taken in January the 23rd of 89, and this young lady was nearly 11 years old. See, we should have been started and had that tooth kicked backwards in the other one too. In fact, these are baby teeth right here, and this is a 6-year molar coming into the roots of this deciduous teeth, of this deciduous tooth anyway. Alright, in this particular Panorex, now this is number 1. This is when we first picked this up. The cuspid is crowded way out up here, and the second bicuspid is down in here somewhere, and then this is the second bicuspid is up in here. And now the 6-year molar is drifted up this close to the lateral, and you're going to try to put these 3 teeth in there. In fact, we do put them in there, but the midline is shifted over here. The whole case is screwed up, really it is, from this lack of pushing this tooth back. So now the tooth on the other side of the mouth, if you notice this deciduous tooth, part of the enamel, part of the tooth is gone back here on the back side, and it doesn't eat the enamel away, but it may have buckled it up or something there. But there's a flaw in this, and this tooth has moved forward also. This one, the whole deciduous tooth is gone, and this tooth is up way up further than it should be here. Alright, now this is another Panorex a little later on. This is January the 23rd of '89, and the second Panorex, but you can make out these bicuspids up here crowded on top of one another. Now this one you can really do it. This is later on down the line, and this is still '89, and this is the third Panorex. This is the second bicuspid, and this is the first bicuspid, and they're absolutely right on top of one another. And here's the cuspid coming in here. This is your permanent lateral right there. And if left alone, if they hadn't come in to get it treated, then we're going to have to back all this up and shove all this forward, get this midline back over here, make space, bring this tooth back here, bring the first bi here and the cuspid into this. That's what we're objective of doing here. Now the other side is coming along fine. See, we've got the spring, open that up, bringing this in. So we're going to have to come in. In fact, we've got spring on there already, and we're starting to open. You can see that spring right there. We're opening the space here. We're going to back this up and shove this forward, get this midline over where it should be. Now all this is brought about simply because somebody didn't recognize this ectopically erupted tooth, and if they did, they didn't do anything about it, or maybe they didn't know how to do something about it. It's a simple procedure if you know what to do with it. It's not difficult at all. It's just kind of uprighting a molar. And I've got several videos on ectopic eruption where the permanent tooth is way in like that, and this is all eaten out in here, and we push that tooth back and save this tooth to hold the space open. If you go back and look at the ectopically eruption videos, you'll see several things in there. But this one shows it after the effect of it and what it's doing on there. So you need to know this, especially pediatric dentists ought to know this. And they should be picking this up early and knowing what to do with it and do it. And it's simple. In other words, I've got one video I call Stitching Time Saves 9, and that darn sure does. If you get in there early and know what you're doing and push a little something, and things happen that save you a lot of trouble later on down the line. All right, here's another Panorex. This is number 4. This is 90. Now we have expanded this. See this spring in here, and push this back. There's your second bicuspid coming in here. Here's the first bicuspid. Here's the cuspid. Now if I can, I'm gonna jump back here and look at these later. I'll erase that. There it was, just the Panorex before that. One bicuspid absolutely flat on top of the other bicuspid, see? Now, we put the spring, move this back, and now we've got room for the bicuspid to come in, and this midline is getting better too. All right. This is lined up good. I think I've got one or two more Panorexes here, number 6. It's lined up good. We got both molars in there, and the wisdom teeth on this young lady are impossibly impacted, so we're going to need to eliminate them. So I send her in, or was talking about it. I don't think I did. Anyway, they didn't go right away. they're still in there, and the bicuspids are lined up now, see, coming through here, and we'll turn that tooth around, and we're going to rotate these 6-year molars too. They're going to rotate back in this direction. But a simple task, by not doing it, created a lot of mess here that you have to do with and over a period of years, and it costs money and all this. And still, she hadn't taken out the wisdom teeth. That's all right. I think we had somebody take them out, but we've finished the case now, see, and we've got the bicuspids in like that, see. And this one was right straight on top of that one. This was way over here. Now we pushed it back. So now we're going to take out these wisdom teeth because there's absolutely no space for them to come in. Okay, let's see. All right, now we're going to show you the individual, the treatment, see. Just what we did here, we put spring in here, but now look, when we started off where the midline was on that, so we had to come over here to bring this midline back. That opened up, and then back the molar up, and it got room for the bicuspid to come in down here. But this is a lot of doing, you know, and somebody could put that little spring on back here and kick that tooth back, and they would have never had this trouble. So preventive and interceptive orthodontics is a big part of the game. And who should do it? It's the guys that are looking at these kids when they're real young, and that's the pediatric dentist. And I think it is absolutely ridiculous that they do not take on and do this task. And but I probably made an enemy out of some people by saying this, but I think it is ridiculous that the people doing pediatric dentistry are not, they don't invite them to do orthodontics for sure. All right, nothing against, I have lots of good friends that are orthodontists, and some of them, we have some of them that teach with our organization, and we have many pediatric dentists that teach in the organization too. Excellent people. So, but there's some up in the hierarchy there that don't think it's what they should do. All right, let's get on with it here. And here we are in the middle of treatment. Now this is that side, you see. This is beginning to straighten out in here now. These are coming over. We got space in here. We're going to put a cuspid in there. And this second bi is going to go in here. And we're going to balance these things out so these sides look virtually the same in here. Now this bicuspid came in lingual. We'll bring it out to the outside. I hope I make it through. I'm getting so darn hoarse. I'm afraid you won't be able to hear this. But I want to get these on the internet. Now here we are. We finished the upper. The midline is right on the money, see? And they're closing down, and we'll finish the lower out pretty quick here. And put a retainer there. Now these retainers, I've said so many times, you do not need to cross the cotton picking occlusal plane with any kind of wire. You don't need to come over here with something like that. If you put this in right, it'll stay up in there with suction. If you need to keep it in, you put some little acrylic pads under maybe a couple of teeth in a triangular shape, and you can fix it where you can't hardly take the doggone thing out, if you want to. So you do not use any wires to run under the occlusion. I hope that rings a bell. And there we are. Alright, we put a retainer, and then we'll put a soft acrylic and bite on it, and we have the head in a normal position when they close their teeth together, and that bite will stay there, and their bite will be the certain depth. They'll have the same overjet and overbite as long as they can. I've had them use these retainers for 30 some odd years, and they still were working. Alright, there we are. And here it is finished. This is 1995 after. It's a good time after we finished. And this is the way it looks. And the midline zone, everything is sucked in class 1. Now there's what it looked like to start with, where this ectopic eruption had come in here and screwed up this whole side of the mouth. Now, you get to it, it's good. You can fix it up when they're young. But if you waited till you were 30 years old and decided to do that, it would be very difficult to do, see. And it's much more difficult starting here than it would have been to start when this tooth was first coming in on the distal side of that deciduous second molar. There's the anterior part. There's what it was. See the midlines here, the gaps over here, the whole darn arch is warped over to one side, simply because a ectopically erupted tooth was not treated early, real early, see. Now we got to it fairly early and corrected it. Now this is the left side of the mouth, which was fairly normal at that time, and it doesn't look too good on this video, but of course it's in the process of eruption too in here. So this is the left part. You can see how it was. Well, no, this is the right, and the left after we treated this case. You see this line going right down through. These halves look pretty much the same. Now I'm going to show you the palate before we started. Now look at how these teeth, as this tooth drifts forward, the thing rotates around here on this lingual root. This one is rotated around too. Now let's check and see if we got that right. Now you see these teeth are rotated properly here, and they were, even this one was rotated. This one was rotated a lot. I'll go back and show you that again. All this happened because of no treatment early on a problem. A small problem becomes a big one. And if it would have been left alone to this young lady was 30 or 40 years old, it would be almost impossible to do it. Now that's, you've got a perfect example of here's a screwed up side and here's a more or less normal side. And that's brought about by a simple ectopic erupting tooth not coming into the mouth right. And now this is the lower arch. We finished up like that. Now I'll get the other tooth in the lower. This side was okay, really. And here's some pictures of her at the end as she got older. A very attractive young lady and a very beautiful smile. Thank goodness for orthodontics. And you can do so many things for people. It is the most gratifying area in dentistry to me, and this will stick with her the rest of her life and make a tremendous difference in what this young lady does and where she goes in life. And that's what you're given this opportunity when you're working on these young people or even older people. So do the very best you can and make it beautiful and function and stable and where it'll last. Now here she was to start off, and this was the side that was given the problem. And you see the midline has gone over to the side. And we got in there and did it. So anyway, this is an interesting thing to do and know. And I hope that many people will see this and go in early and correct these ectopically erupting teeth. Now there may be some people that don't understand what this ectopic eruption is. I'm going to draw a little thing here before I quit. And here is your upper deciduous molar sitting in here, and here's the first deciduous molar. It's smaller, and its roots usually go out something like this. And the tissue usually comes along, well, it'll start in here and kind of come up. But if a upper 6-year molar gets tilted forward and starts in like this, and it erupts down here, the cells go in here and they'll eat the roots right out from under this. And if you catch one that's, say, down here, say the molar is sitting in this place, all you've got to do is put a little tube on the side of this molar and put a rectangular wire in there with a spring, something like this. And if you want to have the spring going up like this, and now come in and bond, you can take deciduous teeth or anything you got over, and just bond a wire on these teeth and make a hook in this, and you bring it down and hook it on that, and this spring in here, you're tightening it up when you go up like that. You bring it down, hook it up in there, and that will kick this tooth backwards. You bringing that down, pull that tooth back here, and it will line that tooth up behind. And even though half the roots are gone, this tooth is still vital, and it'll stay there as a space maintainer till that comes in. If you are not familiar with this, I've got some videos that explain it real good and show you how we back these teeth out. There'd be a big space in here, and then they'd come back forward in here, and it's not difficult to do. So that's correction of ectopic eruption early, and what you see in this video is a little later, and what you would see 30, 25 years later would be a messed up adult that spent their whole life with a problem. So I'm gonna hush up, and we'll close and hope that you get something out of this. So we'll stop.